multiple unerupted supernumerary teeth. One second, everybody. Okay, cleidocranial dysostosis is the one of the important bone disease that we are supposed to understand, that there will be multiple supernumerary tooth, multiple impacted supernumerary tooth, as well as there will be a lot of chances, high risk for multiple dentigerous cysts also. Idiopathic osteosclerosis, this is another very important bone disease, bone condition, where you can see that because of no particular reason, idiopathic, you will see sclerosis of the bone. Bone will be thickened there. That is the idiopathic osteosclerosis. We can see here carefully, there will be bone sclerosis here. That is of particularly no much of etiological significance. Moving on to fibrous dysplasia, this is a very important clinical image where you can see that typically there is a lesion, there is a swelling on the palate, that too unilateral. You can see typically on one side of the palate, and it is a fusiform swelling. Fusiform means, if you can see here, the swelling is not uniform in size. In the center it is very wider. Okay, that is called as fusiform swelling, and that swelling will be painless swelling. So this is a very characteristic image that you have to remember about fibrous dysplasia, where there will be a fusiform swelling of the palate. Now this is a cafe au lait spot that you can see in case of the fibrous dysplasia. Particularly in polyostotic fibrous dysplasia, you will see this cafe au lait spots. This is a radiograph of ground glass appearance, where you can see the frosted glass appearance or ground glass appearance. This is a histopathology of the fibrous dysplasia, where you can see the Chinese letter pattern. What do you mean by Chinese letter pattern? The bony trabeculae are very small C-shaped bony trabeculae. That is called as the Chinese letter pattern. Now this is cherubism. Now what is cherubism? Cherubism is nothing but a type of fibrous dysplasia, typically you see in children, with the enlargement of both maxilla and mandible. And we call it as the eyes upwards to the heaven appearance. You can see here the eyeballs are rolled here. Because of that, what happens is it appears as if the eyes to upwards to the heaven appearance you see in case of cherubism. Now this is focal cementoceous dysplasia, where you can see that in one particular area the bone destruction is there. There is osteolysis. Okay, because of this, you can see radiolucent area that is particularly focal, related to one particular tooth only. Now after some days, in the same lesion there will be bone formation. There will be a mixed lesion. So focal cementoceous dysplasia is a reactive lesion. So initially the patient will have one particular tooth, single tooth is affected, that to the root. You will see one radiolucent area. After some period, because of the cementum and bone formation, you will see the mixed radiolucent radiopaque area. We have one more type of cementoceous dysplasia, which is called as periapical. What is the main difference between focal and periapical is location. Periapical typically affects the mandibular incisors. That to the periapical area, you will see the radiolucency. Remember, these cementoceous dysplasias are reactive lesions. There is no particular treatment required for these. Just it's a wait and watch policy that has to be followed. Okay, so there is no need of biopsy. There is no need of treatment here. Just the patient needs to be followed up, whether any significant swelling appears or whether the patient complains of any pain. Otherwise, it doesn't require any treatment. Third type of cementoceous dysplasia is florid. What do you mean by florid? Florid is something which is widely spread. This is a type of cementoceous dysplasia which is multi-quadrant. Okay, it doesn't affect one particular region of the jaw. It affects multiple sites. Sometimes it will affect in this case, you can see here the fourth quadrant involved, third quadrant is involved, even the center of the mandible is involved. Okay, all these are the areas which are involved in case of florid cementoosseous dysplasia. Now this is Parry-Romberg syndrome. This is also called as the Romberg syndrome, where typically you see that one half of the face in this patient, you can see the right side of the face is atrophic. That means the skin is thin here, muscles are thin here, even the teeth are small here in this case of Romberg syndrome. So this is called as hemifacial atrophy. Okay, this you need not remember. Now this is next Krausen syndrome. Now in this patient of Krausen syndrome, you can see the basically the typically the face of these patients is described as frog faces. Frog faces. Now in this frog faces, try to understand certain things here. In this patient, if you see carefully, there is a ocular proptosis and the mid-face hypophasia. What is mid-facial hypophasia? The maxilla is hypoplastic here. Because of this, it appears as if the mandible is in front. Pseudoprognatism. Pseudoprognatism. So this is what you are supposed to remember, that in case of the Krausen syndrome, there is a mid-facial hypoplasia with pseudoprognatism. Now this is Uppert syndrome. Uppert syndrome, we have to remember that there will be a tower skull. Skull will be tall. And typically you see syndactyly in Uppert syndrome. What is syndactyly? The fusion of the digits. Otherwise, Uppert syndrome is same like Krausen. Only thing extra additional that you see in case of the Uppert syndrome is the syndactyly. Treacher Colin syndrome, this is another important syndrome. This is also called as mandibulofacial dysostosis, where you can see typically the mandible is hypoplastic. Typically mandible. In all the syndromes, usually maxilla will be hypoplastic. In Treacher Colin syndrome, the peculiarity is that mandible will be hypoplastic. And there will be coloboma. What do you mean by coloboma? Is lower eyelid. There will be a notch. That is called as coloboma. So in this image, carefully you can see the second image, side view, you can see carefully that the mandible is hypoplastic. This is another image of Treacher Colin syndrome, where you can see the preauricular tongue-like hair extension. Typically in these patients, in the ear abnormality, you will see that is called as microatia. What do you mean microatia is? Ear are very small, they are abnormal, and in front of the ear, you will see hair-like extension. Hair-like extension. Okay, now next moving on to Paget disease of bone. This is another important disease, one of the important condition of bone, where you see uniform symmetric enlargement of the maxilla. Typically again maxilla is involved, but there will be both side bilateral involvement, and this is called as a Leontius ossea appearance, lion-like face appearance. This is an important radiograph where you can see cotton wool appearance of the skull as well as the maxilla. The cotton wool appearance is because of the radio opacity that you see in case of Paget's disease. I have another image of cotton wool appearance. You can see the lateral skull view. This is a very important radiograph that you have to appreciate. In this IOPA, what we can see in Paget disease is hypercementosis. Typically in Paget disease, you see hypercementosis. What do you mean by hypercementosis? Generalized, all the roots, the cementum is thickened. So this is a very characteristic image that you have to remember about Paget disease. Now in this histopathology of Paget disease, we have to appreciate mosaic bone pattern. Okay, this is also called as the zigzag puzzle pattern. And you can see the blue lines there in the center of the bone. That thing, blue lines are nothing but your prominent reversal lines. So those prominent reversal lines are very characteristic of Paget disease. Okay, now that's about the Paget disease. Now this is Gorham's disease. What do you mean by Gorham's disease? It's also called as massive osteolysis, in which there will be so much of bone destruction that totally it appears as if bone is not there at all. Total disappearance of the bone. That is called as phantom bone disease or vanishing bone disease or massive osteolysis, also known as Gorham's disease. Moving on to the next topic for today, that is diseases of skin. Now let us start with the first condition here, ectodermal dysplasia. In this image, we can see that in ectodermal dysplasia, main problem is with the ectodermal structures, let it be skin, hair, nails, teeth, sweat gland, sebaceous glands, all are affected here. So skin is very thin here, and there will be hyperpigmentation of the skin. Hair will be very sparse and fine. Okay, hair will be very sparse as well as fine. And there is a very important dental finding in case of these ectodermal dysplasia. They will have peg-shaped conical teeth. First of all, the number of the teeth will be very less here. It will be, you will see oligodontia or you will see anodontia in these patients. Whichever teeth are there, they will be very conic, they will be small and they will be conical in shape. They are called as peg-shaped teeth. Now moving on to the second condition, that is the Lyan Planus. Very important skin disease, Lyan Planus. Here we can see the skin lesion in Lyan Planus, that is a papules. So what are the important characteristic skin lesions in the Lyan Planus is papules. Here, this is a very important clinical type of oral Lyan Planus, that is a reticular Lyan Planus. Now what are we seeing in this condition? We are seeing that there is a reticular network of white striae. Network of white striae. So these white striae typically you call as the Bickham striae or Honiton's lace. This is asymptomatic and this is the most common type of Lyan Planus that you see. We have another type of Lyan Planus also, that is erosive Lyan Planus, which is a red area. Red area. We have another called as atrophic Lyan Planus, which typically manifests as desquamative gingivitis. We have reticular, we have atrophic, we have erosive. You have to remember that atrophic is the one which usually typically presents as the desquamative gingivitis. Now this is the histopathology of Lyan Planus, where the blue area that you can see typically are the band of lymphocytes. Okay, here you see the band of lymphocytes below the epithelium. That is a very characteristic image that you should remember. Any clinical, any histopathology they will give you, and you will see that below the epithelium, just below the epithelium, so thick white blue band of lymphocytes you have to consider as Lyan Planus. Now this is the DIF finding, that is direct immunofluorescence finding. You need not remember this, it's out of scope, they won't ask you this as an image based discussion. Now this is a characteristic histopathology of pemphigus. Now condition that we are discussing here is pemphigus. Here this is a pemphigus is a very important condition where you can see suprabasilar split. Okay, you can see this, typically the space is there above the basal cells, that is called as suprabasilar split, and you can see those round cells in the split, that is nothing but your Zank cells. That is nothing but your Zank cells. Now this is a DIF finding, direct immunofluorescence finding of pemphigus, which is known as a chicken wire appearance. Okay, again this can be asked because this is very characteristic. I'll show you one more image. This is a typical chicken wire or fishnet appearance of the pemphigus DIF finding. Now this is paraneoplastic pemphigus, where you can see the lesions which are there are very painful. There are erosive lesions. In case of, remember the type of pemphigus which is very painful is one of the type is paraneoplastic pemphigus. It also involves even the eyes also, conjunctiva. Now this is a typical case of the cicatricial pemphigoid, or it is also known as benign mucous membrane pemphigoid. Pemphigoid, we are talking not about pemphigus, we are pemphigoid. Pemphigoid is of two types, bullous type and cicatricial. Cicatricial, which is also known as benign mucous membrane pemphigoid, it typically involves the mucosa. Let it be oral mucosa, let it be conjunctiva. In this image, you can see Typically, it is involving the gingiva, and the gingiva is very smooth and shiny, attached gingiva. That is known as desquamative gingivitis. And other side, we can see the eyes. There is symblepharon. What a symblepharon is? There will be adhesion of the conjunctiva, palpebral and bulbal conjunctiva. That is called as symblepharon. So attached, this desquamative gingivitis is a characteristic condition that you see in case of benign mucous membrane pemphigoid. Actually, benign mucous membrane pemphigoid is the most common cause for desquamative gingivitis. So how to identify desquamative gingivitis? It is typically identified by the gingiva being smooth, shiny, and generalized inflammation. Now, this is a histopathology of pemphigoid where you see subepithelial split. In pemphigus, we see suprabasilar split or intraepithelial split, whereas in pemphigoid, we see subepithelial split. Okay. Now, this is a characteristic clinical image of erythema multiforme. Erythema multiforme, there is a type or a syndrome called as Stevens-Johnson syndrome, which is a type of erythema multiforme. In this type, typically you will see the oral manifestations, and the lips will have bleeding encrustations. You can see there will be blood that is oozing, and that blood will get encrusted. That means dried off. That is called as erythema multiforme major or Stevens-Johnson syndrome. This is the typical bull's eye or iris eye lesions or target lesions that you see on the palm in the patients of erythema multiforme. Okay, this is a compilation of all the images. You can see here there is a bleeding encrustation. Typically, remember, the most common site that is involved in erythema multiforme is lips. It can involve the buccal mucosa also. There will be erosions there. And on the palm, you will see the target lesions. This is a typical butterfly rash that you will see in case of SLE. In systemic lupus erythematosus, you will see the involvement of the lesion. That means this lesion, typical lesion, is seen on the malar area as well as the nasal bridge. And you will see the important oral manifestation in lupus erythematosus, that is palatal ulcers. That is a very important MCQ. Sometimes they'll ask you single liner MCQ. Most common site for ulcers in SLE or DLE is palate. So palatal ulcers are characteristic. Now, this is another image of scleroderma. There is a skin condition called a scleroderma. Here also, typically, this is same like your Parry-Romberg syndrome, but malformation is more here. And in this condition, center of the forehead, you will see something called as Coupe de Sabre. What do you mean by Coupe de Sabre? There will be a depressed ridge in the midline. That is called as the Coupe de Sabre. Now, in this case of systemic sclerosis, you also see microstomia, that is a reduced mouth opening. Why this reduced mouth opening is seen? That is because of, again, fibrosis, sclerosis that is taking place. So, clinically, systemic sclerosis or scleroderma mimics oral submucous fibrosis. In oral submucous fibrosis also, we will see trismus. Same way in scleroderma also, we will see trismus. This is a very important IOPA finding for scleroderma, where you will see widening of the periodontal ligament space. Remember, they'll ask you very commonly single liner MCQ, which is a skin disease where you see widening of the periodontal ligament. You have to answer scleroderma. There is also a characteristic OPG finding of scleroderma, where you can see the ramus. You can see that typically the ramus. How is the ramus? Very thin. It appears as if it is a tail of a whale. It is very thin. It is very narrow, compressed. That is called as the tail of a whale appearance in case of scleroderma. And last image, this is called as Peutz-Jeghers syndrome. Now, this is the last image for today's discussion. Peutz-Jeghers syndrome. Peutz-Jeghers syndrome is one particular syndrome where you will see perioral pigmentation. So that is called as perioral freckling that you see typically. You see that in case of on the lips as well as the around the oral cavity. So these are some of the important characteristic images that we have discussed. about the diseases of bone as well as diseases of the skin. So in the next YouTube session, we will discuss with the image based discussion for the miscellaneous topics. So if you can track, so already we have discussed odontogenic tumors, odontogenic cysts. Okay, now we have completed the diseases of bone, diseases of skin. Last, we will take last session on the YouTube on the image based discussion of the miscellaneous images which can be asked. So there is actually the studying the images is very important. Looking at the images, you will try to recollect at the time of examination. So if you remember the Peutz-Jeghers syndrome, perioral freckling, pigmentation, as well as the lip pigmentation, you can easily answer that this is a characteristic Peutz-Jeghers syndrome. Okay, thank you very much for your patient listening. Forensic odontology, we will soon upload that. Okay, within 1 or 2 days you will get this on the app. Thank you so much.